Okay, so I just want to introduce what the robotic guided surgery is. A lot of my patients have some curiosity about what is it you're actually operating when you're in the operating room. Well, this is the robot, which you see here in front of you. It weighs nearly 1 ton, and it has a robotic arm here, and then these 4 discs that send information to and from the camera. So this camera, which I'm pointing to up there, is a very important integral part of the procedure. You can see here on the monitor we have patient information, no specific patient for this purposes, but you can see the shape of a knee. That's someone's actual knee that's been imported in on a CT scan, and it's captured information. And we have all these points that we can capture during the procedure to try to make the execution of the partial or full knee replacement as accurate as possible. So the way that works is we have different probes. This happens to be the sharp tip probe we use in knee replacements. It's a rigid probe with 3 different arrays attached in a triangular fashion. This information we actually put on points on the patient's knee, or when I'm doing hip replacement in their hip, and this information is beamed to the camera. The camera, which you see up there, picks up this information, and that information goes right back into the computer program. When we analyze the computer program, we get real-time feedback on what we're doing during the surgery. So this is one of the newest evolutions of joint replacement. We're having real-time feedback on the computer for where our bone resections are going to be, and even for soft tissue balancing. The neat thing about the technology is when we're doing an application on a patient, it has a specific burr that comes out. This is for knee replacements, partial and full knee replacements. For partial knee replacements. For partial knee replacements, there will be a burr tip which we can engage to make the cuts. Now, I actually have my hand on the robot the entire time I'm doing the surgery, so I'm watching very carefully while we make the bony cuts. This is for partial knee replacement. In full knee replacement, this part here is replaced with a saw blade. And we actually have ways to make very specific saw cuts on the patient's knee. This is able to enhance the accuracy and component positioning. When it comes time to do that, there's a part of science called haptics that is employed. So haptic technology is the science of touch. And once we decide where we want to make our bone cuts, we lock it in with the robot, and it will only allow me to make the cuts that I want to do, the cuts that I've planned with sub-millimeter accuracy. That's the amazing thing about this new technology. So it is technology. It's a very fancy piece of equipment. It's a very fancy operative instrument. It's not like lasers or anything like that, although some people like to think so, but it's a very precise, I call it a very precision operative tool. In hip replacements, it's the same sort of thing. We have a different arm attachment on here, but instead of a burr or a saw, we actually have a reamer. And what happens in hip replacement is once we map it all out, we bring the arm in, and it helps us to make a very accurate reaming of the acetabulum at a very specific angle of abduction and inclination. Those technical terms are important in that it's trying to make the cut position and component placement as accurate as possible. Once we do the bony preparation, we're able to attach the actual implant to the robot. So again, hands-on, we're very much hands-on. We insert the cup into the acetabulum, the robotic portion of it kicks in, and it locks in exactly where we want to put it, and then we just hammer it in. This is a little bit different than manual instrumentation and manual implantation, where we'll have the cup come in freehand, and we'll use varying degrees of techniques that each surgeon has developed over time to put the cup in as exactly as possible. Doing the direct anterior approach, sometimes we'll use fluoroscopic guidance. That's the main way of determining component positioning. I like to use this technology for hip replacement in combination with robotic guidance because I think it has great application, because the pelvic array, which is attached to the patient, is actually out of the way of the surgical wound. It's actually on the opposite side of the pelvis. In that way, I'm able to do my work on this side of the patient without that coming into play at all. So the bottom line is, I think that what I wanted to show you is that these are some of the latest advances in orthopedic care for hip and knee replacement surgery, which are only going to keep developing over time as we do more research and find better algorithms to solve this problem of trying to do the best hip or knee replacement possible.